You ready? Mm-hmm. Hi, my name is Dr. Monica Flores, and today we're going to be talking about chest pain in a young patient, child at school age to maybe a teenager, and who complains of chest pain. So chest pain in young people is usually not heart. But if it is heart, it's usually going to be associated with exercise. So I run, I play, I get chest pain, that I would worry about. Or it would be associated with issues like palpitations, where the heart beats weird, boom, 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 boom. Or if it beats too fast, or if you have the chest pain and then you have associated symptoms like shortness of breath, I turn blue, can't catch my air, any of those things would be what we call dangerous, needs to be worked up immediately type chest pain. Then you have chest pain that comes from the lungs. Usually when you have chest pain from the lungs, there are lung symptoms, shortness of breath, cough, wheezing, exercise intolerance again. It could be onset or precipitated by or made worse by deep breathing. I breathe deep and all of a sudden my chest hurts. So that's usually something that comes from the lungs. And then you have musculoskeletal pain, which is the chest pain that comes from the muscles. There's actually 3 layers of muscles that are between our ribs. And when we breathe, those muscles stretch out. And so if we've done some sort of exercise, we played on the trampoline, we did Pilates for the first time, we tried out for band holding a big old trombone for a long time, and that could irritate those muscles and cause pain. But when that happens, it's just like any other pulled muscle. It's daily for a certain amount of period of time, and it's reproducible. I push on it hurts. So that is musculoskeletal chest pain. And then last but not least is chest pain that comes from the intestines. You eat Takis, which you should never eat, really spicy food, you eat late at night, the food from your stomach can reflux up into your esophagus and cause a spasming of your esophagus. And just because the food from your stomach is filled with acid, it burns your esophagus and it can give you chest pain. In adults, it can get so bad that they think they're having a heart attack. So those are the places where we have chest pain. A lot of chest pain in young patients nowadays, in my opinion, can be induced by a little bit of bad posture and bad breathing exercises. So when we are young, we tend to spend a lot of time doing this or this. Oh. And so when we do this, if we notice what's happening to our lungs inside here are being squashed, are being pushed down. When we do this, our lungs are being stretched out. When we do this, if we think about the anatomy of our lungs are air sacs. They're tiny itty bitty balloons that are inside these two, tiny balloons inside a big balloon. And so when you do this, those balloons stick together. Oh. And then when you stand up, they unstick. And just like if you've ever pulled a scab off of your skin, the unsticking hurts and it can give you a pain that you're like, ow. So if you're having chest pain, think about your breathing and your posture and make sure that you're standing up straight, that you're not hunched over constantly. You're already hunched over 8 hours of the day at school over your school books. When you're home, don't hunch over. Stand up. And throughout the day, do some deep breathing. So every period between school, between classes, breathe deep. When you breathe deep, it expands all those tiny little air sacs and holds them open and then exercises them. So it's less likely that you're going to get that sticking when you do have bad posture. So do that throughout the day, 5 to 10 times, deep breaths. Think about doing some mindfulness exercises, that whole meditation stuff, or you can pray, but pray with breathing. Don't just pray. Breathe while you do it. Meditate and breathe. Those two things together will exercise your lungs and keep them open. Also, don't do your homework on your bed. When you do your homework on your bed, it encourages, let's see. See, when you're on your bed, look what you're doing. All right? It encourages this posture. Instead, do your homework either standing up, on a standing desk, or sitting on a desk, or even better, sometimes stand, sometimes sit, sometimes stand, sometimes sit. Again, a little bit of exercise that happens on a regular basis will help your lungs expand and will prevent that sticking of the lungs and those weird, ouch, pains when you breathe. Okay.